Okay, hi, we're just getting started on the left shoulder. We're looking at from the back to the front. Everything you see is magnified 30 or 40 times on the screen. Here's an example of a torn biceps tendon there. See how that's frayed and rough? And then we can see how the anchor's rough as well. We're going to take a spinal needle and pass it through the biceps here so that we can secure it a little bit later. But there's our first pass through the biceps. Right here. Pull out the needle, and then we're going to pull the relay through that gray cannula. Now, I pulled the black wire is called the relay. So we're going to load that black wire with a suture, and in just a minute you'll see how we pull that back. We'll go ahead and pull that back through right. And that's what we're doing with this pair of scissors that you see here. So now the biceps is just about released. There's a little bit more there. We'll press that with our shaver. Okay, so now we're going to go ahead and take a look around the rest of the shoulder here in just a minute. Start looking towards the back of the shoulder. This looks pretty good. No signs of any significant problems here. As we come up to the front of the shoulder, we can look down the front. There's the middle glenohumeral ligament. And then finally we'll look up at this rotator cuff tear spinal. So basically right through here is where the tear is. You just see the edge of the biceps. Pull that out of the way. But this is where we're going to be working here. So we're going to take a marker stitch and pass it right through this part of the tendon here. Back here it looks like it's attached, okay, but right in here is where it's detached. Top of the screen. And now that we've got enough into the joint, we'll go ahead and back out the needle. Okay, so here's our guide for our suture anchor here. We're going to go ahead and the guide right there, it's basically what we call mid-footprint. I'll show you what I mean by that. There's the articular surface down there. That's actually the cut edge of the biceps, for which we will get a pop-lock suture anchor, 3-5. We're going to go ahead and place our anchor for our rotator cuff repair right about here. You can see how it's coming through the eye there, through that little window. Now we're just going to tap it down into the bone. And then once we have that down in the bone, we're going to go ahead and unload it. Pull tight on it, and that feels very solid. So now we're going to go ahead and take out one suture at a time to pass these through the torn tendon. First step, okay, then hold the picture right about here. You can see that gold instrument, that's called a crochet hook. And this allows us to move the sutures around. And we're going to take this, looks like we can take the solid blue suture first. Or the blue and white stripe from either one. So we've got the blue and white stripe suture. Put these other ones out of the way. And now we're ready to make our first pass. See how we have the hook angled right at the anchor? We're going to hold this still right here. And then we'll use an instrument called the grasper just to help us stabilize the tear as we pass the stitch through it. So we're going to reduce it like that. And then there's our needle coming underneath. We'll go ahead and feed that relay. And now you can see we have that going through that clear cannula there. We're going to load that black wire with the blue and white suture in just a minute. See how it brings that with it? And here it is coming through the blue cannula on the right side of the screen. We'll take a crochet hook and get the partner blue and white suture here. Okay. Looks like we want to take that this way. We'll go ahead and tie that first knot. Second one, we're going to rehearse the repair. It's going to be right about here. We're going to pull this back, go through the tendon, and there we are right there. That looks pretty good. Pause. We're going to tie the solid blue ones here next. Hold the camera there. You can see them sitting there. Good. We've still got to work on securing the biceps. That's our next step, and we'll get to work on that in just a minute. Biceps. We're just going to tap this down. And once we have it down most of the way, we can tension the tendon. Just by pulling on the individual sutures. One, pull on the other one. It's actually pretty tight, so we'll go ahead and take this all the way down. Check our tension again. Pretty tight there. Pretty tight there. So we're going to go ahead and lock that down, and that'll be the end of the case. Okay? So now we're just going to cut those sutures and get you back to the recovery room in just a few minutes. Got this all done for you. It's been about 45 minutes, which is pretty good time. It's not a race, obviously, but we don't want to be here any longer than we have to. We're going to go ahead and make a couple little holes in the bottom using a punch. I'm going to go there. I'll try and show you that here. So. Here's our punch coming down. We're just going to make a couple little holes in the marrow just to release some of the healing cells and other factors in the marrow that help things heal. So there's one. Okay. Look over here to the right. We'll make another over here and finish up. So hopefully that does the trick for you, okay? Good luck to you now. Bye-bye.